Hey friends, welcome and welcome back to my channel. If you are new here, my name is Raquel, aka Nurse Rocky, here on YouTube. I'm really trying out here to be consistent and give you guys valuable content. So make sure you hit that like button, that subscribe button, and the cute little notification bell right next to it. So one of my subscribers, Mixed Beauty, and I missed some numbers in there, had commented on one of my videos asking for some top tips for new grads in the ICU. I want to encourage you guys to leave comments down below, leave suggestions, questions. You never know, they can get their own dedicated video. And so thank you, Mixed Beauty. I wanted to bring you guys some top tips for all you new grads out there generally, but especially in the ICU. So if you're interested, keep watching. So my first tip, and I want to kind of talk to you guys as if I'm like talking to Mixed Beauty in person or like somebody in person, and really just kind of like make it casual. I may not always be politically correct or professionally correct, but just to be candid, honest, y'all know I like to keep it 100 with y'all. So the first tip that I would say speaks towards the mindset. So you have to level out your anxieties, your worries, your fears. Don't panic. That's my first tip. Don't panic. If there's something that you don't know, which there's going to be tons of stuff that you don't know, find somebody that does. Find a safe person. Find any person. Nursing, if I'm being honest, isn't always 100% safe. We try not to have that bully culture, and I know there was a campaign about that, but realistically, nurses are mean. But find a safe person. If you can't, find the person who knows whether they're safe or not. In nursing, you have to let go of your pride, your ego, or any perceptions that you may think will fall on you if you don't know. Asking for help is completely normal, and in situations in the hospital where you would typically panic, there are way too many people around you that would know the answer to the question that you're struggling with, that would be able to fix the problem that you're having. So panicking is never the answer. First of all, patients, if they're conscious at the time, can see that you're panicking. And it doesn't help the situation. Number two, it just doesn't help the situation, period. It doesn't help you think clearly. It doesn't help you with anything that you need to get through that situation and to solve the problem that you're facing. So number one, don't panic. When you're not able to handle something, utilize the people around you that are. Learn from those situations and count them as wins. Even if you feel like you didn't know, even if you feel like you didn't perform the way you wanted to, you're learning, you're growing. And that leads me into my second point, is understand and be okay with the fact that you're not going to know everything. Nobody knows everything, not even the veteran nurse that fronts at the nurse's station. No, she does not know everything. You're going to be constantly going through this learning process, and we are the hardest people on ourselves. And I think people in general, now I know you can't find me on Psychology Today, I'm not certified, but we do need to give ourselves grace in life, period, but especially professionally as a new grad nurse, a new grad ICU nurse. First of all, baby, you are a boss already for being in this position, to where you are starting your career in such a critical area. So you have lots to learn, and you're not going to know everything. But take comfort in the fact that you are going to be an active participant in the process of learning. And I say active as a key word, which leads me to my third point. Ask questions unapologetically. Now, I know I talked about that already with not panicking, but even in situations where things aren't emergent or critical, ask questions. Learn as much as you can. This is not the time to be thinking about, oh, I'm gonna look simple if I ask this questions. Yeah, you can critically think a situation before you open your mouth to ask a question, but even if it is a simple question, ask it anyway. Make sure you understand rationales for things. Yes, you can always look up things at home or kind of try and figure things out on your own, but that's not wise. When there's people who have experienced more than you have, when there's people that have seen more and done more, it is always wise to utilize them as resources and just pick their brains, ask questions. A lot of veteran nurses, they know the tricks, they know the tips, They know what works when certain things that doctors want to order or prescribe doesn't work. Like they know, oh yeah, that usually doesn't fix that problem. I know what does. So ask these people questions like that. So you know, like pick people's brains and really try and get into why things are done the way they are. Be curious. Curiosity may have killed the cat, but it makes a really good nurse. So stay curious, stay questioning everything, and don't apologize for it. Your knowledge, your understanding, your skill set depends on it. The next tip I have, which I probably should have mentioned closer to not panicking, is focus on providing compassion and care. And I know that sounds like a textbook or like some CEO's welcome to this hospital kind of speech, but it's important that you provide compassionate care over anything else. And I think this is the better version of fake it till you make it, because when you don't, even in situations where you don't know stuff, patients and family members and people around you can see that you're focused on the patient's health, the patient's knowledge and understanding, even when you don't have it yourself. So when they can see that, oh, she's really concerned about me learning why I'm about to go into this procedure. So like it kind of helps them bypass the reality that you don't know, that you don't know what's going on. You don't know anything about their procedure. And I'm not justifying that, because obviously we talked about knowing where to go to get information and knowing who to ask and all of that. But I think it's important to have that as the forefront of your practice instead of scrambling around and trying to fake it. You can't fake stuff in nursing. When somebody asks you, what's this for? You can't fake that. You can try and do all kinds of word combinations and sales pitch statements to make them believe that you know what you're doing, but it's really hard to fake it till you make it in nursing, period, and especially in the ICU. I think presenting yourself as a compassionate caregiver is way easier than trying to fake it, scramble around and fake it. Just, Miss Jones, you know, I don't know the answer to that right now, but I really want you to feel comfortable before your procedure, and so I'm gonna have somebody come in and explain that to you. That sounds so much better than, well, so I'm not really sure why you have to take this medication because I didn't really have the chance to look at the chart because I was so busy. Or like, I mean, there's a million things that you can sound like when you're faking it till you make it, rather than just being sincere and compassionate in your care. So focus on that is what I would suggest as you're navigating this whole thing, as you're figuring it out, because there's a lot of things you're not gonna know up front and you're gonna look crazy. The next tip I would say is get as much exposure as you can. Use all your senses. Watch as many procedures. Listen to as many conversations. Get your actual hands on as many things as you can during this training process, during the newness where you're following somebody, or even in the period where you're on your own. Reach out to nurses around you. Make yourself available to help them. You learn a lot that way as well. Volunteer to try and put in IVs. ICU is the perfect place. Not trying to be disrespectful or rude to anybody's family member in an ICU, but a ventilated and sedated patient who could potentially use that IV is a good practice for somebody who needs work putting in IVs. So be wise and be available to learn. Like, utilize all the resources that you can get. There's always something going on. Like I said, use all of your senses. I'm gonna recap. Watch as many procedures, listen to as many conversations, get your hands on as many things as you possibly can. I ain't got nothing you can taste, so we gonna leave that sense. We gonna leave the taste. We gonna leave the taste and smell out of this, because ain't no way we can use those positively unless you just trying to sniff for C. diff. Another tip that I want to give you guys is to work smarter and not harder. Make sure that you are prepared. Make sure that you're prepared well enough in advance. If you have a patient who's on drips, make sure they're ordered ahead of time. Look at the rate that they're going. Like, simple things like that can save you a heartache. When you have a patient on a presser and it runs out, because you know pharmacies stay tripping, you need to be on top of those things in order to prevent other, other challenging situations from happening. Look at the things that you're look at the things that you're gonna need throughout your shift. Manage your time well and prioritize your tasks appropriately. And the last tip that I want to give you guys is to find outlets and ways to de-stress. Nursing period is going to be overwhelming and emotionally exhausting. And especially as a new grad where things are just there's so much at once and you're unable to digest everything. Find ways to decompress after your shift. Find ways to decompress. Find ways to cope. Find things that help you to take care of yourself as well. That is most important in this whole thing. Need I reference the put your mask on first example? Okay, we all know how important it is to take care of ourselves before we try and take care of somebody else. And especially now during COVID where there's additional emotional factors that are at play with families and increased mortality rates or anything that you may be experiencing in the workplace, in addition to what's naturally challenging and what's naturally there. So take care of yourself. So lastly, I just want to encourage you guys, keep going. You are capable, you are competent, and you have the capacity to be an amazing nurse. Anyways, that's it for this video. If you guys have any questions, any comments, if you are an established nurse and you have any stories or encouragements for our new grads, especially during this time, leave them down in the comment section below. Let's start a discussion and be an encouraging community for our new grads right now. Thanks again for rocking with Nurse Rocky. I will see you guys in my next video.